everyone, you're listening to the Tea with Tanya podcast, and I'm your host, Tanya Ambrose. I'm a public health professional by day and your average tea-loving millennial and content creator by night. My goal for this podcast is to share public health stories, self-love and wellness tips to educate and empower and to promote positive living. This podcast is here to serve you. Join me in the tea tasting room to see what I have brewing for you. Hey everybody, welcome back to another episode of the Tea with Tanya podcast, where we talk all things wellness, public health, women's health, everything here. And I'm joined, I know I say this about every guest, but it's just the truth. I am joined by a very special guest today, joining me from all the way in Africa. She'll tell us where in Africa she's joined. I think, is it Uganda?
Yes.
Yes. All the way in Uganda, Africa. I'm happy to have her here. We're going to be talking about PCOS and, some women's health issues that we're all facing. So everybody, welcome Chichi. I'm going to say that right? Chichi.
Yes.
You don't have an accent. Okay.
Hi. Greetings, everyone. Yes, Tanya is indeed right. I'm speaking to you all the way from the motherland. I am Nigerian American, born in Washington, D.C., grew up in North Carolina, and I found my way to here in the motherland by where I was working for the United States Center for Disease Control here at the U.S. Embassy in Uganda, where I focused on gender-based violence, working to prevent it and just strengthen our violence response programming here in Uganda. And I just wrapped up a contract, and now I'm transitioning into my own space where I am breaking into still focusing on the issues that I am super passionate about, the social justice issues, reproductive justice issues. I just received my full spectrum doula certification.
Yeah.
Yes, so I'm very excited just to talk with you today about, thank you so much about PCOS, and thank you so much for inviting me.
No problem. I'm happy to have you here. So I do want to ask, because you say you're Nigerian American. So how has your upbringing influenced your career choice? Because when you're from these parts of the world, we're told to be one thing, doctor, teacher, whatever it is. So how has your upbringing influenced?
So for anybody who has a Nigerian friend, I know Nigerians are all over the world. Like, I came to Uganda thinking I was going to be the only one. Nope, far from the truth. We got hundreds of thousands over here. So,
I believe that.
But yeah, I'm Igbo, so I can't speak for other tribes. But in my tribe, education is very important. And, growing up, even to come home with a B, I mean,
I know.
You barely get away with that. Don't even try coming home with a C.
Okay.
Yeah, so of course, when I went to UNC Chapel Hill for undergrad, and my parents really encouraged me to try to pursue either a profession in medicine, nursing, pharmacy, the classic professions, because for them, I understood where they were coming from. It all boiled down to what can you do to make money and be comfortable and take care of your family and to be self-sufficient, right? But for me, my heart has always, right from the dawn of time, I was always like, I want to help people, right? I was never really thinking about the money part until recently when I decided to become a serial social entrepreneur. But yeah, fast forward to now, and I have many certificates. I have 2 master's degrees. I have a master's degree in public health, a master's degree in social work, and I just recently, last year, I officially became a certified project management professional. So I have a super interdisciplinary background, and it's not because I don't know what I want to do. It's just because we live in a society, we live in a world where there are people, I feel like it's a generational thing. My parents, both of them, have been in the same job for the last 20, I think my dad has just celebrated 30 years of working for the state. He's an engineer. Whereas with us, we know that if we stay at the same job for 20 years, we're doing a disservice to ourselves, because if you continue, studies have statistically shown you on to the next job, you can increase your earning potential. It opens up doors for leadership opportunities. You don't stay stagnant or stuck, right? And so
I like when you said that, it's not like you don't know what you want to do, but we're living in an ever-changing world. So I'm happy you said that, because to me, I want to do this, I want to do that. I'm like, what if somebody's going to tell me, oh, girl, you're doing too much? That's something that I've battled
by HR
in the past.
Yeah.
But I'm like, no, I'm not going to say somewhere where I'm not
happy anymore. If I can go on to do better, or as I say, earning potential is much better, it increases, we can help people. But that's, at the end of the day, it sounds cliche, but my goal really is to help people and to make this world a better place. I'm only one person. We're only two people here, but even if we can impact one person, that's the goal. So I'm happy that here I am doing everything I can get my hands in. People are like, oh, girl, make up your mind. Do what you want to do. Or I'm like, no, I know what I want to do, but, it involves getting all these other certificates as well. So, you mentioned earlier that you're a full spectrum doula. I am a doula too. So what what was your journey like into becoming a doula? Why? How did you know what a doula was, and why did you want to become a doula?
I was very ignorant, and I've been working in reproductive and sexual and reproductive health, but within an international development space. And so in international development, it's a very whitewashed space. And being a person of color, being a minority, I just was not, it wasn't until during the pandemic, I had to leave Uganda. Privilege, huh? Everybody else gets to stay in Uganda. We only get to be in Uganda when there's not a pandemic. But pandemic hit, all of a sudden we have to find our way back to the US, right? And so it was just got me thinking about all the different privileges that we have. And I come back to the US and I'm hearing about the fact that the maternal mortality rate among Black women in the US is horrible compared to other Western nations. And I just kept on hearing horrible stories, horrible anecdotes.
Yeah.
And then I kept on seeing this word doula popped up, like, get you a doula. Whatever you do, get you a doula. So I Googled it and I'm like, oh, interesting. And I came across this program. It's called the Birthing Advocacy Doula Training Program. And what I really liked about it, because of course there's the International Doula Association, or DONA, I think is like,
yeah.
But no, this particular program that I went through, they really cater to, they address all the different intersectionalities, whether it's you're a Black woman, you're a single woman, you're Latino, you're gay, you're transgender, whatever it is, whatever your sexual identity is or your identity in general, that largely impacts and affects our experiences, our birthing experiences, right? Our birthing journey.
Yeah.
So I knew that I was very ignorant and I wanted to, that's why I decided to pursue the training. And so it's been a year in the making, a little over a year in the making, and I finally was able to get through the program, but it was so beneficial to I realized how ignorant I was. I actually found myself feeling super guilty because it's like, you never really think about how some people choose to be single and they want to go through that birthing experience on their own. And then, we had like single parents in the class say, oh, well, when I would go to birthing classes, people would just automatically assume that I had a partner when that wasn't the case. And that wasn't my experience.
Right.
And I started thinking about all my single friends, my friends that are single parents, and I'm just like, start feeling horrible, right? You realize that you have all these unconscious biases that you don't even take into consideration. And in as much as I identify as a minority, I realize I have a lot to learn. So it was very insightful. It was also spiritual for me. And I think that it was timely because at that time, I had also been diagnosed with PCOS. And as a Nigerian, you know how like you get married, the first thing you do, if you're not pregnant within the first 3 to 6 months, people are looking at your belly. People
are asking questions.
Coming for you, right? And so it's like, the moment I was diagnosed with it, family members are telling me, whatever you do, you go on dates, don't bring it up. Why? And so,
oh my goodness, that's so true.
Yeah. And so I realized, wow, this course is also like, it's not just about me learning about other people's experiences. This is also going to be my experience, right? Because, and we'll talk about this more. So
that's interesting that you said it because I didn't know what a doula was until I was in school trying to figure out, okay, what do I want to do? And I had a keen interest for maternal and child health because I had an experience with my sister when she had my first niece. She had her 20 weeks and they were like, gearing towards the 50% outcome that was going to be negative. Me being a little sister, I was like, oh no, we're not going to do that. But then I was an advocate then, but I didn't even know what the meaning of the word advocate meant even in that moment. As you said, I was young, naive, ignorant as well. And then when you go to school and you see all the maternal mortality rates, it's like, especially among African Americans, it's like, what in the world is going on? Why is it that this is so high compared to another race or something? So I'm like, someone told me she was doing her MPT. She's like, you should become a doula. I said, what is a doula? And the phones and our the way how society is now. You mention one word, talking to somebody, your phone automatically hears you, and then want to pop up something on your Google. All of a sudden, Google is telling me, "Oh, doula, that I'm passing a sign on the highway about hire a doula." I have never seen that sign before when driving to and from to school. And then that one particular day I saw it, I was like, "What in the world?" And of course, did my research, and just like you, it's been a year and a half in the making now, and I'm happy I made that decision because it's so fulfilling. But I will tell you, I don't know if you have that experience. I know you say it's spiritual for you as well. Breath work is spiritual. It's like a lot of hard work, and you usually drained at the end sometimes because you're putting all your all, and you got to make sure that you are present for the birthing for mom, of course. But it's a lot of hard work that goes into being a doula, guys, because it can get very spiritual, especially if you're a spiritual person. But let's transition a little bit, because you said on your quest to becoming a doula, that's when you found out you had PCOS. And we know how many different myths and so many things that happened or is being said when it comes to people who have PCOS. So we're going to talk about it a little bit. But guys, a disclaimer here. I'm going to let Chichi give you the disclaimer before we even continue with this conversation. Okay?
I am not. All my only credential that I have, I'm only a social worker. These views are my own. I am not a medical doctor. I am not giving you medical advice. I am purely speaking largely from my own experience and my own self-education. And yeah, if you are having issues, if you have any concerns, kindly go and visit a doctor.
Yes, and just take what we're saying, with a grain of salt. We're trying to educate you so you can then in turn go and see your medical provider. Because again, we're not medical doctors here. She's just speaking from her experience. I'm just here to talk about what I know, what I've heard. Okay, guys? So you're not going to say Chichi and Tanya said, I have PCOS. We did not say that.
Yeah.
Okay? But as we get into it, let's talk about PCOS. Tell me, for those who don't know, what is PCOS? We know it's an acronym, abbreviation. Like, what is PCOS?
Yeah. So PCOS stands for polycystic ovarian syndrome. It's a hormonal disorder, and it's something that usually causes enlarged ovaries with small cysts on the outer edges of the ovaries, right? And so that's where you get the term polycystic ovarian syndrome. However, you might not necessarily, when I went to the doctor and I was having symptoms, for me, my symptom was irregular periods. We did ultrasounds. Like, we did so many tests. We ran so many labs and they didn't see any cysts, right? So it's tricky. So we'll get more into that. So the cause of it is not well understood. And in addition to that, there's so many factors that come into play, right? But we'll talk more about it.
All right. So what are some symptoms? Because I know even though we've spoken before, but what are some symptoms for those who don't know?
Yeah.
Okay, I may have PCOS. Like, what are some possible symptoms of PCOS for those who of us, we're here just getting our periods? Because, sometimes what I've learned with endometriosis, that can start earlier on when you have like really bad period cramps, but you think it's just normal because we normalize women having abnormal pain during their cycle. So what are some symptoms of PCOS?
Yeah.
How is it different from us having our period?
Right. So usually you might notice that you have some type of menstrual irregularity. So either you're not getting your periods at all, or you are getting your period and you're experiencing very heavy bleeding. You might notice excess hair growth underneath your chin and other parts of your body. You might experience out of nowhere excessive weight gain. Might have acne all over your face. We never used to deal with acne. There's so many. We'll dive deeper, but what I will say is that as a woman of color, as a Black woman, I think it's important to share that PCOS does affect women of color more frequently and more severely than white women. And because this is a topic where there's just ongoing research and we don't have all the answers, we know that it's associated with metabolic syndrome. Losing weight is not a magic cure for PCOS. If you've ever been diagnosed with PCOS, I'm sure the first thing that your doctor told you was you need to lose weight, right? And that's what I was told. And it was crazy because I'm extremely athletic. This is at the time that this is happening, I was playing basketball 5 days a week. I was doing rigorous, intense exercise. So I knew something was wrong. I can't help but wonder, maybe if I wasn't someone who was super active and I was experiencing this, and my doctor had told me that, I really would have taken it to heart. But I knew something was wrong because of the fact that things were not adding up, right? And so I think it's important to mention that, because PCOS, you're asking what are the symptoms? PCOS doesn't present the same way for everybody. And later on, we'll talk about the 4 different types of PCOS. It doesn't present the same way in every person. And doctors often resort to providing the same advice. So either tell you to lose weight, tell you to go on birth control, tell you to engage in some sort of dietary change time and time again. And even if the patient has already exhausted all of these approaches without results, to no avail, they make it seem like you're the one who's crazy. And if you're listening to this podcast and you're someone who, if any of this is resonating with you, I just want to tell you, you are not crazy.
So, because I have someone close to me who's been recently diagnosed with PCOS, and prior to that, they were like bleeding for weeks upon a time, like at least close to 3 months nonstop. Like I've never even known that was a thing that's possible. Because I can't relate to that, and I'm like, you should go get checked. And then the first thing that they did, because I want to ask, how was it diagnosed, if based on your experience, because they were just bleeding months at a time, and we kept saying, that's not normal. Mm-hmm. She's like, it could be stress. I said, yeah, we all have stress, but to be bleeding nonstop. It's not like it's stopping. It's like nonstop. Yeah. And then she went to the doctor, and the first thing she did, like you said earlier, you need to lose 10, 15 pounds. You need to go on birth control, these different things. So how was it diagnosed? How were you able? I know you said, you realized something wasn't right, but how, if you can tell us, how is PCOS really and truly diagnosed for someone who's experiencing that?
Yeah. Well, first of all, before we talk about diagnosis, it might be helpful to just share, because I'm sure some of you who are listening to this podcast, you're probably wondering, what causes that thing? What could lead to somebody bleeding nonstop? Because that's how we got here. I had my period since I was 10 years old. And then I hit, how old was I? Was I 28 or 29 at the time? And out of nowhere, and for me, that's why I said this is very spiritual. Like I literally, it's so creepy, but I had a dream. I woke up, I said, something is not right. Something has changed. It's never going to be, I didn't know what it was. Then I did not get my period. I didn't get my period. Then for like a month or a month and a half, then when I got it, like nonstop heavy. I have just like, so I'm like, is this a spiritual thing? Is somebody doing juju on me? If you're African, you just
yeah.
Who did it? Like, right? Yeah. And so for me, I was just like taken aback, because this is somewhat like 10 years, for 19 years, I've been A-okay. So the reason why I share that anecdote with you is because the exact cause of PCOS is unknown. And some people say like genetics plays a role, there are environmental factors, it could be a hormonal thing. That's why people focus so much on dietary stuff. And I strongly do believe that it had to do with, because I was not living in the US. I was living in South Africa. And I was living in Swaziland, which is, for those of you who don't know, it's like an hour away from the border. But like if you're going to Johannesburg, South Africa, like it's like 3.5 hour drive. And so most of their food is imported from South Africa. And we do know that they do use a lot of hormones in, I said hormones, but like chicken, pesticides, all that stuff. So anyways, I just wanted to share, we don't know. That's the one thing we're not sure about. But you were asking, how is it diagnosed, right? And so when you go to a doctor and you're having any type of issue, what the doctors typically do is, it's called the rule out method. They ask you, what are your symptoms? What are you experiencing, right? And so, funny enough, my doctor never told me there were 4 different types of PCOS, right? But now,
let's talk about
research, that. How can you treat a condition that you have if you don't even know what you have? And so in order to effectively treat PCOS and reverse the symptoms naturally, you need to know what type of PCOS you're dealing with. And so what doctors typically look out for, well, let's go through it. There are 4 different types. So I'll just go through the different types and share what doctors are looking for, right? So there's something called insulin-resistant PCOS, and that's the most common type. So it affects around 70% of people, and insulin resistance is basically where there are higher levels of insulin than normal in the body, right? And your body doesn't know what the heck is going on. It's called hyperinsulinemia, and it happens when our cells become numb to the effects of insulin. It causes the pancreas to pump out more and more insulin until cells get the message. And in this type of PCOS, you may be struggling with your weight. I think this is what I had, right? And so you're holding weight around your stomach, your abdomen, you're having crazy sugar cravings. This is why a lot of people are resorting to working with nutritionists instead of, medical doctor or in partnership with, in conjunction with. But yeah, you might have, I love sweets in general, so I always have sugar cravings. But yeah, you might be dealing with extreme fatigue. I had that issue, brain fog. Like I just was not remembering.
Wow.
High levels of insulin. That's what essentially drives up your androgen levels. That's also what contributes to excess hair. I definitely have like chin hair, right? And so doctors will typically test your glucose levels. They might even check to see if you have a thyroid issue. And so they want to know like what's happening with your blood sugar levels. But it doesn't give us the full picture. So in order to rule out insulin resistance, you actually need to have your fasting insulin tested. And so I could share more. I think I should put a blog post up on my. You know what?
Yes, definitely.
Can comment.
Well, now that you said that first part, because like I said, I didn't know, guys, that there were 4 types of PCOS. I just say, it's just one general symptom. I remember someone close to me, they had to get their fasting glucose taken. And I was like, what? I'm like, why is that important?
Yeah.
Why are you guys doing that? You just been bleeding nonstop. What's the problem? Then when I did my research, I was like, oh, that's when I found out that there were 4 types of PCOS. I was like, what in the world? Again, something that you don't really see anywhere.
And I think that
unless you actually go vividly looking for it.
Exactly. And like people are always, it's not that there is some truth in, oh, you need to lose weight. But the problem is that you can't do not all type of I had to learn the hard way. Like I said, I was playing basketball. I'm very athletic. Like I play football, I play soccer, I play tennis, I go swimming. And I later learned, no, do not. If you're doing any type of like intense, like rigorous exercise, that actually can it can stress your cells out, stress your body out. And so that's why what you'll notice is people say do like the slow weighted exercises, like high intensity.
Okay.
Yeah. And so for me, when I started doing that, it helped me, I would go on long walks. It's ironic because I'm someone I'm always moving, but like, no, I literally had to pace myself, go on long walks, not do rigorous exercise, be very intentional about my movements. And it helped me. Out of nowhere, I just started losing weight. People would see me, Chichi, what's going on? And so it helps your body to burn sugar throughout the day and build muscle and improve your sensitivity to insulin. So I can share more later, but there's also something called post-pill PCOS. I never knew about this. And this happens to people after they stop taking the oral contraceptive pill. Did you know this?
No, I said that was a shock. I didn't even know because again, most doctors, they're pushing the pill or birth control on you. And so to see that, I'm like, what in the world? Again, something I was just mind blown, people. Like I was really mind blown that was the thing.
Yeah. And so the reason why this happens is because, and this is where you typically see like acne, and this has happened to a lot of my friends. They stop taking birth control and out of nowhere, their face just they get serious acne, which is funny because when you have crazy acne, what do people tell you to do? Take birth control.
Yes. That is so true.
Yeah. So I've actually taken like Yasmin. I don't know. In the US, I guess like there are different brands, but it's because what contributes to this is when you're taking birth control pills, you're using synthetic progestins, right? And so after coming off the pill, your ovaries are basically throwing a party. And so there's a natural surge in androgens. And that's what causes like the hair growth that you don't want, typical PCOS symptoms, right? And so, but for this type, there's no insulin resistance. And after 3 to 6 months, people just tend to heal on their own. But you can address it once again quickly through nutrition, lifestyle, exercise, herbal medicinal support. Herbal medicine has helped me a lot. For that one, it's all about prioritizing sleep and stress management and being patient, getting your magnesium, your vitamin E, zinc, etc. So then the third type, adrenal PCOS. And this type of PCOS is due to abnormal stress response. And it's so funny because I'm like going through all this and I'm like, all of it resonates with me because I was very stressed. I was going through a very deep depression. I had gotten out of a very crazy breakup. And like, I strongly believe that all these things just triggered because it was just my body, like the stress on my body could not handle it. And that's what happened. Like stress, people really underestimate how stress will just have your whole body out of whack.
Out of whack, yeah.
Right? And so when you have an abnormal stress response, there's a type of androgen, it's called DHEA. I can't remember what it stands for, but it's a type of androgen from the adrenal glands, and it elevates, right? And so then you end up with high levels
testosterone,
yeah, and stuff like that. And for that, you typically have to go see an endocrinologist, right? And so to treat that, once again, manage your stress, get your sleep. I was not sleeping. I would pull crazy all nighters, and anytime I pulled a back to back to back all nighter, it would trigger my PCOS. Because like doctors would say, go on birth control, because that's how I had to just resort to like natural. Because I would go on birth control, things would stabilize, but then I would engage in horrible behavior. I wasn't sleeping. I was stressed. I would find myself in toxic spaces, and it would trigger it. And boom, we're back to the same space again, right? Avoid high intensity exercise. You want to limit excessive and high intensity training because it can put a stress on your adrenals. And when I think about this, I'm just like ding, 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 because that's what I was doing. Like I was working out like crazy. And then last but not least, inflammatory PCOS. I had inflammation. And I was just like, what is going, like out of nowhere, my knees, my joints, excruciating pain. I go to see an orthopedic doctor and they're like, oh, it's probably because you were playing soccer. You probably got knocked. You know what I'm saying? But then it's like, as I'm reading through these different types, ding, 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 I'm like, that's what it was. I was dealing with chronic inflammation because, and when you're dealing with that, it causes your ovaries to make excess testosterone. So then you have issues with ovulations, then you get headaches, joint pain, unexplained fatigue. You might even have eczema, which is funny because like I just came back from South Africa and it's cleared up now because I was out of nowhere. I just saw like a patch of the human body is incredible.
It is.
And so, yeah, in order to treat that, once again, you have to address your gut health, right? And I don't know, for those of you who are, I don't know if you've heard the word leaky gut. You have to balance, like take your probiotics, eliminate any type of just bad food, like greasy food, all these things that really do have an impact on your gut health. Remove all the food triggers. I would bring a whole box of grapes and eat the whole thing, but then it's like they put like all kinds of stuff in those grapes, like salt.
Yeah,
a mess. And then there are also like natural anti-inflammatories, which now I use like a lot of like omega-3, like I take primrose with the omega-3 fatty acids, turmeric, etc. But once again, I'm not a medical doctor, so hit up your practitioner.
But guys, like Chichi just said, there are 4 types of PCOS, and it's important to be in tune with your body too. So that's how sometimes you can tell when something is off, because sometimes, like you said, you've been having regular periods, you've been super athletic, and then one day, you missed the period and you started bleeding nonstop. So obviously, be in tune with your body, guys, and that will let you know something is off. So again, I'll repeat the 4 types of PCOS. There's insulin-resistant PCOS, there's post-pill PCOS, adrenal PCOS, and inflammatory PCOS. Those are the 4 types of PCOS. And I personally, I'm not going to be embarrassed to say it, but I did not know that there were more than one type of PCOS because they don't teach you that in school, even on the news, even on social media. You have these different advocates. I've never heard anyone say, oh, I have post-pill PCOS, or I have, these are the types of. Maybe I'm following the wrong people. I don't know, but I just never heard that. But you did mention something, I think, was it inflammatory PCOS when it talks about fertility. So I know, as soon as anyone that I know or I've come in contact with, when they say I have PCOS, the first thing that goes through their head, oh, I can't have kids. Oh, I want to have kids, or I'm not going to be as fertile anymore. That's the first thing. And then they just start panicking.
Yeah.
So are there any facts behind, or does it affect fertility, PCOS?
Yeah. So science, right? Because I'm sure when I was in 5th grade, that's when I was learning about the menstrual cycle and all that good stuff. But before we get there, I just wanted to say, because we were talking about like how can you go about diagnosing it? I just wanted to mention PCOS oftentimes gets misdiagnosed for something else that's called hypothalamic amenorrhea. And the reason why I'm bringing this up is because people kept on telling me, go get your thyroids tested. In hypothalamic amenorrhea, your period can stop due to undereating or over-exercising. And if you become real excessive with it, it's similar to PCOS, and it can present with like mild acne, excess hair, growth, and a polycystic ovary appearance on an ultrasound. But that's a misdiagnosis. The reason why it's important to know that is because you need to be aware of, and I learned about all this stuff just because, so there's something called like luteinizing hormone, the LH, and then the follicle stimulating hormone, FSH. And they're supposed to be, like in PCOS, there's a 2 to 3 times higher The LH is 2 to 3 times higher than the FSH, and it should be 1 to 1. And that's what happened to me. So in hypothalamic amenorrhea, usually the opposite is true. The LH is much lower than the FSH. And so that's why you have to make sure that you're getting all these tests. Because if you don't get these tests, you
guys, I hope you guys are
be
listening
misdiagnosed.
to Chi. Yes, as we say, I'm hoping they're listening to you. We're not medical doctors, but these are things that, again, once you're in tune with your body, if you're going to see a medical doctor, have some questions.
Yeah.
If they're telling you, it could be PCOS, this is a good thing for you to listen to, this podcast, so you guys can have some questions to ask your doctors. Because again, at the end of the day, it's important that you are your own advocate. Because who's going to advocate for you? Your doctors, they may have your best interest, yes, but you want to make sure that you have some sort of knowledge so you can speak up for yourself.
Yes, you need to be your own best advocate, because these doctors would have you out here thinking you're a psychopath and that you're crazy. I just kept on thinking I was crazy. Like some doctors can be very condescending. And so you they take it personally. They feel like, oh, you went on Google and you did. And it's like, yes, we do have Google. We're empowered, and there's no harm in asking clarifying questions. You're not coming in acting as if you're, more knowledgeable than the doctor, but you just want to make sure that all the right tests are being conducted and that you're not being misdiagnosed so that you can get quicker recovery, right?
Before I forget, just to add, because, as African Americans or as Black people, we're not always being treated the right way in these settings. So as Chidi said, advocate for yourself. Don't be embarrassed, or don't be afraid to ask them questions, even if they want to look at you in any way, any condescending way. Let them know, I know this much, so I need for you to guide me and help me now. You're not going to tell me, oh, take this, take that. Why am I taking this pill? I need to know everything before I'm going to agree to this treatment plan.
Yeah.
So make sure you guys, again, advocate for yourself in that part.
Yes, absolutely. Thank you for sharing that. So you were asking, does PCOS affect fertility? Well,
yes.
A lot of people don't even know that they have PCOS until they try to get pregnant, right? And so PCOS is very common but treatable cause of infertility. And women who have PCOS, or let me not use the word women, let me be gender. If you are a person and you're experiencing PCOS, the hormonal imbalance interferes with the growth and the release of the eggs from the ovaries. And so if you are not ovulating, you cannot get pregnant. And so there are ways to manage and to address this. Like I said, it's treatable. And so you can have a discussion with your doctor and talk about ways to help you ovulate. There are things that assist with ovulation, like there's ovocitol. Is it inositol? Ovocitol is new. But yeah, you can raise your chances of getting pregnant. There's also an ovulation calculator to see which days that your menstrual cycle you're more likely to be fertile. It's important to remember that PCOS is a hormonal imbalance. That's what it is. So that's the reason why it's compromising egg growth and the ability for your egg to be matured and to be released. All of this impacts ovulation. So the end goal, like if you have PCOS, you're more likely to have a regular period. So you can go several months without having a period. And some people only get it like once or twice a year. And so if you are not ovulating, you cannot get pregnant. But if you are ovulating, you can. So some women that have PCOS, they're still able to get pregnant naturally. It's just that if you're experiencing issues with your ovulation, it could be very unpredictable, right? And so that irregularity is what can make it difficult. And so it's not that you can't, you can. It might be a difficult journey. And then egg quality. Egg quality can also be affected by PCOS. So even if a woman ovulates, she still might be having a hard time conceiving. So it's important to also understand the nuances.
Right. So I want to backtrack a little bit early on when you said, sometimes environmental factors play into someone developing PCOS. So the question is, what are some risk factors as it relates to PCOS? You can elaborate on that for me.
So it's just like any other disease, right? When people talk about what are the different ways that contribute to the development of disease? It could be environmental, it could be genetics. So when it comes to risk factors specifically for PCOS in adults, if you've been diagnosed with type 1 diabetes or type 2 diabetes, like I mentioned, it's a metabolic disorder. So the hormone imbalance ultimately affects your ability to manage. That's why it leads to excessive weight gain and other symptoms. And so gestational diabetes is also a thing. It's dawning on me because I learned that my mom had gestational diabetes when she was pregnant with me. And so I'm like, wow, like even though I guess my parents just did a good job of eliminating stress in my life. So like all these years I've been fine. And then out of nowhere, boom, right? And so earlier we were talking about how women who are African American women are more likely to experience PCOS. Well, think about the type of diseases that are common, and not like from cardiovascular disease to diabetes to these things, right? And so the thing is, if you have like hypertension, all these things, and that's why earlier you mentioned like that's why you need to test like your fasting glucose, your blood pressure. These are things that, yeah, studies have been done, and results of these studies indicate that risk factors for PCOS like include irregular menstruation, family history of infertility, diabetes. Maybe your mom had irregular menstruation. Maybe you're even noticing changes in your mood. You might have a mood disorder, lack of physical exercise, all of these things. And now that I think about it, I went at one point in time, I was like super athletic, and then out of nowhere, I just stopped. So when you have such drastic changes, your body is just like, our body is just forever trying to we want homeostasis. We want some sort of balance.
Yeah. So I want to switch a little bit to epigenetics. There's still a correlation there. So let's talk a little bit about epigenetics. Let the people know. I know it's something that you're passionate about. So let the people know, what is it and how can it correlate with PCOS?
Yeah. So for the epigenetics is a big word. So for those but when I heard it, it went way over my head. And I first learned about it when I was in my public health MPH program. But I'm very intrigued by it because it makes a lot of sense. So epigenetics is the study of how your own behaviors and environment can cause changes that affect the way that your genes work. How crazy is that? Like literally, you could be, because whenever I used to hear the word genetics, I used to always think my genes that I was born with.
Yeah, right.
Epigenetics,
me too, that's it.
With epigenetics, this has nothing to do with like the genes you were born with. This has to do with genetic changes like happening right here and right now, right?
In real time.
Yeah, like
real time.
A change in your DNA sequence. And as a result of some exposure to some sort of like environmental, I don't know, toxin, or, earlier we were talking about being exposed to pesticides, to crazy hormones. People are injecting these chickens and these animals, right? And so it's important to know that epigenetics can be, reversible. They don't change your DNA sequence. They just change how your body reads the DNA sequence. And so that's referred to as DNA methylation. And we get real sciencey here. But all you need to know, all you need to know is that it can be influenced by environmental factors such as diet, hormones, stress, drugs, exposure to environmental chemicals. And oftentimes, do we even know what we're being exposed to? Like, you hear about,
listen,
don't when you use a water bottle, don't use a water bottle that has BPA in it. But then you realize there are other types of BPA, right? Like there are literally so many different. And then it's like manufacturers can get away with using other types of BPA. And so it's like, we don't know. We don't know. But the reason why it's important to talk about epigenetics is because when you think about PCOS, earlier I was talking about how it's a common genetic disorder, right? And so people who are diagnosed with PCOS, it's like, first of all, we don't even understand the pathophysiology. Like we're still doing research, and we don't know whether or not the change in the way that the genes are being expressed, if that can play a role in PCOS, right? So the idea is that, maybe your mom or your grandmother never had PCOS, but because you consumed some sort of toxic substance, whether it's like you inhaled it, you drank it, you ate it, whatever, it's changing the way that your genes are being expressed, not changing your genes, not changing the DNA sequence, but it's changing how it's being read. And so as a result, that could probably set off a trigger that will ultimately lead to you having some sort of hormonal imbalance. And so there's a lot of research being done, right? And trying to figure out what leads to the pathogenesis of PCOS. But that's why earlier we were saying it could be environmental.
Do you think trauma as well could be a contributing factor as well?
Yes,
To that?
absolutely. Studies are showing that exposure to stress can definitely modify your DNA methylation, like the way that your genes are being.
Yeah.
Stress affects everything. And so the
Everything.
reason
Yeah.
why it's important to talk about stress is because, you could be a young child and before you even hit puberty, your genes are already changing because your genetic expression is already changing because you're being exposed to some sort of adverse childhood experience, right? Childhood
Mm,
abuse, any type of stress related disorder can have lasting effects on methylation and can persist into adulthood. And then you don't realize it. Then out of nowhere, you're trying to have a baby and you're like, what's going on? It's
yeah.
never even ran in my mom never had to deal with this. And it's so funny because my grandmother had 9 babies. And out of all her 9, and
Wow.
she popped them out. No issues, nothing. And she was so
Yeah.
confused because like she had 7 girls. And out of the 7 girls, I was like one child got pregnant with twins, lost the baby. Like she was like, I don't know how far into her gestational period she was. But then another
Right.
one struggled, couldn't get pregnant for 13 years, and finally got pregnant. And she's just like, I don't
Wow.
understand why my girls are struggling to get pregnant. I never had these issues. And I'm like, we don't
Right.
know. It could be some stress.
So many
So many
factors. Yeah.
factors. Yeah.
And the way how this world is running right now, we have to really be careful
Yeah.
because the environment that we're living in, as I say, we don't know what we're congested when we're out in these streets. There's just so many. I think that's the scary part. You do your best to maintain a healthy lifestyle, but then you walk outside and you're just coming in contact with something that could cause an issue in your life. You know what I
Absolutely.
mean? That's the scary thing. But I do want to ask your opinion. This might be somewhat controversial. I don't know. But like I said, I have known a few people that are close to me that have experienced PCOS. Some went on to have kids naturally on their own. Some are still battling it. But the first thing that they've been told when they go to the doctor, what I've been seeing happening over and over is, oh, get on birth control. That's the first thing. From the minute they go and they think, okay, you know what, it's PCOS. I guess maybe after they run whatever test they may run, or they just assume, they try to rule out certain things before even giving a thorough exam as well. The first thing that they say is go on birth control. Now, everybody have their own opinion about birth control or not, but I want to hear your view because why is it that the first thing is always birth control?
Yeah.
Like why can't we say, why can't there be so many other different things? Why it has to be birth control? So what is your take on that?
Yeah, I mean, well, when the doctors explain it to you, they draw out the diagrams, they tell you what's happening, they tell you you're not ovulating regularly. It's not that birth control doesn't work. It can treat it, and it does treat it, and it will treat it. However, are we just putting a band-aid? So for me, it's very much so a temporary solution. The moment you stop birth control, what happens? You go back. That's what happened to me. You go back to having the same issues. I don't want, no, like, I want this to be, I can't be dealing with this for the next 30 years. I just need to make lifestyle changes so that I can normalize and stabilize and manage my symptoms and that I won't have to deal with issues like, if I'm trying to get pregnant. So I don't tell people to each his own. You can do whatever you want to do. For me, I couldn't. And I think when I did take birth control, like my doctor was like, you can be on birth control until you need to get pregnant. Oh, hell no. Hell no. I said, for me, I committed to doing it for 3 months. And the only reason why was because at the end of the day, this is science, right? And so when we did the ultrasound, we did the test, we found that my progestin levels were very significantly. I was actually having the opposite issue. I started off, my issue was that I was heavy bleeding. At this point in time, I wasn't bleeding at all. And so because I wasn't bleeding, it was like, okay, clearly hormonal imbalance again. And it makes sense because at that point in time, I was wrapping up a contract, taking 50 million classes, once again, super stressed. So when I saw that I had low progesterone, it's just basic science. Like, what is birth control? The idea is that you're trying to bring those progesterone levels back up. And for the first time ever, my one of my ovaries, not both of them, one of them was presenting as polycystic. But when I was first diagnosed with it, it wasn't. Like, my ovaries were fine, like they looked normal. And so it made sense because I was like, okay, it's stuck in the lutein phase or whatever. Because the eggs are refusing to mature, that's the reason why I'm not getting my period. So I said, I'm going to commit to taking birth control for 3 months and 3 months only. And did I even get to 3 months? I don't even think I think I took for 2 months. And then I was like, let's see how things are going. Things stabilized and I stopped. And now, since then, it's been how many months now? It's been about 6 months. I'm getting my period on a regular basis. I don't know about my egg quality, but for me, I'm just really all about let's do this thing in such a way that the human body is powerful and the human body needs to do what it was meant to do. And so we just need to play our own part. I can't be not sleeping at night, eating unhealthy, and expect to not have issues. That's not how that works. Right. So I said, okay, let me make a commitment to myself. If I can get my life together, get my ish together, and practice healthy eating, exercise on a regular basis, take my natural herbal supplements, and things are, if I can get to that place where I'm having that stability, I don't need to be on birth control. What is the reason?
I agree with you. And guys, listening to this, I hope you can take away at least something from this episode in particular. But again, be sure to advocate for yourself. Yeah. So of course, as you say, it's science, you don't have to, because sometimes they'll tell you, be on birth control, like you say, until you're ready to have kids. Mm-hmm. Why should we be taking something in our body?
I think for me, it was
say 5-10 years.
The unknown, because my mother passed away when I was 7, and she had breast cancer when she was very young. And like I said, she had gestational diabetes. I'm pretty sure when I think about all her, even she was overweight, and then you look at photos from when she was 16 years old. When I was 16, I wasn't even that skinny as a twig, right? And so I'm just thinking about all those things, and I'm like, the doctor even told me, well, if your mom had breast cancer, this actually will even help you. They'll tell you, and protect you from ovarian cancer, right? And for me, it's like, we don't know. Are you God? And I just don't. It's for me, it's fear of the unknown, right? And I just want to be in a place where my body is doing what it was meant to do.
Yeah, I agree. So before we wrap up, what are some lifestyle changes you had to make? Because again, guys, we're not out here telling you what to do. She's just speaking from her experience. And if it resonates with you, by all means, we're happy for that. But what are some lifestyle changes you had to make? Because I've seen on social media, you need to eat this particular type of food or eliminate, gluten or dairy, whatever. So what lifestyle changes?
Yeah, for me, my gut health was what I wanted to get back in order. I just felt like my gut health was out of whack. How did I know that my gut health was out of whack? Well, I took a food insensitivity test, and that thing was not cheap. So let me just go ahead and acknowledge that I was very privileged enough to have been able to take this full, I think it cost me $1,000, but it was so helpful, so informative. I realized, wow, Chichi, you have really bad gut health, because I'm eating things like broccoli and they're telling me that I'm super sensitive to that. Almonds. Oh, wow. They normally tell you to eat when you even have to
eat, right?
What else was I having? Even oatmeal. It got to a point where I felt like I was a bird, because my nutritionist was like, stop eating. I know you love you some cashew nuts. Stop. Don't eat nuts for 3 months straight. Let's only eat seeds. So I was eating sunflower seeds. And the reason why was because she was like, you're experiencing very high sensitivity. Your body is reacting to this. And if your body is very insensitive to it, what happens? Your gut is not absorbing the nutrients. Your body is not breaking it down in such a way. It's not taking what it needs from these food items that are considered to be healthy. I mean, now I'm in a much better place. I'm eating almonds, I'm eating all these things, and I'm not having crazy reactions. I'm even eating gluten. I had to go gluten-free, dairy-free. I was only eating sunflower seeds. I was eating dark green leafy vegetables. I couldn't eat kale. I think my body was reacting to kale. It's crazy. You just know, it's like we can't win. I just felt like I couldn't. I was so frustrated. But now that I'm eating all these things and I'm fine, right? And I'm losing weight. Yeah. There are so many factors that come into play. And that's why I say a doctor can't just merely tell you lose weight and take birth control, because each and every human being is different, and we all react differently, and we really have to figure out. I had my doctors, they were like, we don't need to take this test. You're going to take this test. You're going to take I want the thyroid test. I really was doing nonstop research. I said, I want every single type of test in the world. Food intensive. I took all those tests and I felt so much more informed by the results. And I was like, okay, now I know that I can do this, I need to do this, I need to do that. And then, of course, forcing myself to get at least 7 to 8 hours of sleep, which is damn near impossible.
Well,
I know it's
I know,
world.
right?
And I don't even have kids, so I don't even know how women who have kids do it.
Yeah, I'm like, kudos, shout out to you, women, because I'm struggling already, and I don't have a family in that regards yet. So I don't know how you guys do it. But
yeah, and I have social
kudos to
work
you, right?
background, so meditation is big for me. Like I downloaded these when I go to sleep. If I'm struggling to sleep, I play my meditation apps and I pass out in 2 seconds. And so I think just drastic lifestyle changes is what. But then like so drastic. I mean, I don't feel. You know how there are people who have diabetes, and out of all of a sudden, one of my friends, she loves seafood, and out of nowhere, she just started having a shellfish allergy. And she's like so depressed about it, right? And so it can be emotional and it can take an emotional toll on you. It's like, I love my sweets, so I'm not going to completely eliminate it. And I also think that it's important to say, don't bash yourself. If you're deciding to like go gluten free, I went gluten free, boom. But then it was like, no, what if I just scale back on gluten 80% and I'm still having some gluten? And I did that and I was fine. I was still losing weight. So it doesn't have to be an all or nothing type of thing. And you don't need to bash yourself if you relapse. Like just think like pick back up
and
where
just
you
like life, you do everything in moderation, and it takes what they say 21 days to break a habit. You just gotta pace yourself. And I think for me with other things, I think it's like a mindset situation. You gotta make sure that you tell yourself, be intentional. For me, I'm a writer. I write everything down. I'm intentional. I need reminders, stick up all around me so I can say, you know what, I'm not supposed to be eating this. But again, take it in moderation. I think that's the best key.
I agree.
Before we go, Chi-Chi, I want to know, I know you say you have a social work background, so of course you have so many different experiences, but for people, like I said, I know someone, when they got the PCOS diagnosis, they got depressed, like they were so sad, because people automatically think, you know what, it's a death sentence, or I can't have kids, or that's the end of my world in that regard.
Or
So
it might even affect your sex life. Imagine you're
even that too,
nonstop.
Right.
Yeah.
So, your partner may not quite understand, because let's be honest, there are some partners who they do understand some, and even if they do understand, it can become frustrating if we're being honest, So what are some ways, or what are some, I don't want to say coping mechanism, but again, people think, oh, it's a death sentence, or I'm not going to have kids. How can one cope with the diagnosis? Obviously, you guys are going to advocate for yourself. You're going to make sure that you put in the work to change your lifestyle. But, that first time the doctor tell you, you know what, you have PCOS, you go home, you start thinking, because we're humans, you start thinking, and then if you're a Black woman, the statistics again when it comes to almost everything in this world, when it comes to us. So we already got to fight on a regular daily basis. So then when you add in this to the mix now, it's just another stress that added to the pile of stress that we already have. So how can one, when they get that diagnosis, what advice do you have to them? I guess taking that advice and just trying to make that lifestyle change and not let it be something that maybe turns into depression or you think is the end of the world for you. What advice do you have?
Yeah. Thank you for that question. So what I'll say is that I was depressed. I was like, what in the world? Like, it drained me. It sucked the living daylights out of me. I would be so exhausted. I would pass out, go to sleep, be so fatigued, right? So it does take emotional toll on you. Then if you want to have babies and you're like trying so hard, and that's the worst. Like infertility and the way that society judges a woman, and just you need that support, right? And there are fertility doulas out there. So get the support that you need. You don't necessarily have to do everything by yourself. You don't have to be like strong. It's okay to break down and cry. There are certain coping mechanisms. Feel free to reach out to me. Like, I mean, I offer doula support services, I'm a certified deaf doula. The reason why I'm bringing that up is because I actually have clients who like they do everything in their power to get pregnant. And then it's like, yay, we're pregnant. And then I just had a client who came back from my travels and I'm like so excited because she's like, I want you to be my doula. And then I come back, I'm like, how are things going? Unfortunately, the baby's heart stopped beating at 10 weeks. That's hard. And, that's still part of your own, fertility journey, your birthing journey, right? And so I offer that bereavement support. I offer that emotional support. Having a social work background is so helpful because I have been trained. I've been clinically trained on how to work with someone who's dealing with depression. It's not easy. You need to have a strong support system. And so I highly recommend just reaching out to either it's not I recommend therapy actually, but if you afford therapy, if you don't feel like therapy is your thing, maybe consider getting a doula.
and then also reach out to your nutritionist.
Yeah.
I find that these days it's somewhat easier accessible. I know, of course, a lot of things are still a challenge, but definitely, go work hand in hand with your doctor and your nutritionist to just try to change your lifestyle. It's what you need is one small step, guys. You don't have to make a drastic lifestyle change. And then because that to me is also stressful, thinking, oh, I got to go buy this, that, and the third. I got to change this right away. No, as Gigi would have said, do it
very
gradually.
Expensive. Like I was taking these probiotics, which really help with the ones that I was taking. They don't use dairy; they use coconut, and it's kind of has like this yogurt like texture, and that really was life changing. I took it like you just take 2 every day straight, and it had like all the bacteria that was in your womb, like when you first came out of your mother's womb, your that gut bacteria that you were born with. And that really helped me, but it was not cheap. It was very expensive. And so I had to come up with very creative ways to figure out a way to get that stuff reimbursed, right? Through my health insurance provider. And for those who don't have the privilege of investing in all of those things, that's why it might be helpful to work with a doula, and because that's what the doula's job is to find a way to help you access the resources that you need. Because you don't want to find yourself in a very helpless situation.
Yeah, I agree. Well, Gigi, this was a great episode. I learned a lot, especially that 4 types of PCOS. What in the world? I did not even know that was a thing. So I'm really happy. I know we're like, 8 hours? You're 8 hours ahead of me.
Yeah.
So thank you for taking the time out for, coming to inform and educate. And again, guys, we weren't giving medical advice. We're just speaking from her experience. I've got to put it out here again because I don't want any issues. We don't have that title yet. Yeah. Maybe one day we'll be able to an expert, but no, we're not at this moment. But thank you so much, Chichi. And of course, let the people know where they can find you on your social media, website, anything that you have going on. Anything you have, we can support. Let us know.
Yeah. If you're looking to connect with me via Instagram, Twitter, my name is Afropreneur. So it's spelled like entrepreneur, but Afropreneur. So AFROPRENEUR. CHI, so Afropreneur. I can be reached by email at info@afropreneurchi.com. My website is www.afropreneurchi.com. And feel free to connect even via LinkedIn.
LinkedIn is really like like Facebook to me.
Yeah, absolutely.
There's so many things you can do, but definitely thank you so much for coming on. And of course, I'd like to have you back to talk about so many other things you have going on, especially life as a doula in the motherland. We're definitely gonna have you back to talk about that, because that's gonna be interesting.
Sure.
That's gonna be. So thank you so much.
Thank you. Cheers. Take care.